All right, so the first thing I do is I check the physician's orders, and then I would wash my hands. And then I would identify myself to the patient and get their identity by two methods. Like, hey, my name's Tanner. I'll be your nurse today. Can you list your full name for me and your birthday?
Candace Jade Harold, 7/12/96.
Okay, all right, let's see here. And then I would provide privacy for the client. Whip it on over here. All right. All right, today I'll be performing a respiratory assessment, a lower extremity assessment. I'll be administering a topical medication, and I'll be giving the sterile dressing change. Is that all right?
Yeah.
Do you have any questions about the procedure? All right, well, I'll be back in just a little bit.
Tell me when you're ready.
How are you doing today?
Good.
Good. I'll be performing a respiratory assessment today. I'll be listening in 18 different places for your breath sounds, and I'll be listening side to side and from top to bottom. Is that okay?
Mm-hmm.
Okay.
Okay.
Get
Go
this
right
on.
to the front and
I'm going to ask you to take deep breaths.
Now I'm going to clean my room first. I'm going to squeeze out any excess saline, and then I'm going to start with the middle and clean
All right,
downwards.
for these next two.
And then do the distal part, and down, and then drop it. Then I'll squeeze out any more excess, and then I'll do my optimal side.
All right, now I'm going to do the sides.
This one. Now I'm going to dress my leg.
Do this side.
Now I'll take my ABD
Okay.
pad.
Now I'm going to do the back, okay?
Now I continue with my hand.
Take a deep breath.
I'm going to take my gloves off. So I can administer tape first. So I'll take my glove off. Put my hand in the middle of the hole, and then I'll put my two fingers under the cup with the steps. And then I will take this piece of tape.
You can just say, sir, that I'm gonna take this piece of tape. Okay.
I'll take this piece of tape and I'm going to
Everything sounds great. Clear breath sounds. You're ready to go. Hey, how are you doing today? Good. I will be performing a lower extremity assessment on these days. Is that okay? All right. So the first thing I'm going to do is I'm going to assess for color, edema, lesions, and symmetry. Do you mind pulling up your pants legs for me? Okay. No lesions, no edemas. The color is good. And then I'm going to palpate with the back of my hand for temperature on both legs. We'll go like that. Okay. And then I'm going to get you to take off your socks. I'm going to check her cap refill. Okay. And her toenails appear to be painted, so I'm going to use her big toe on both for cap refill. Okay. The blood return is less than 3 seconds, so that is normal, and that's a good thing. So what I'm going to do next is locate the dorsalis pedis and the posterior tibial pulses. So I'm going to get you to get right here. Okay, there. All right, I feel it good right there. Okay, it's good right there. Let me feel it right here. All right. Feel it right here.
You can just sit up.
Okay. Pulse grade is a 2+. And then next thing I'm going to do, she's going to get her socks back on, and then I'm going to test her muscle strength. All right. What I'm going to get you to do first is I'm going to push towards you, and you push towards me, okay? Okay, that's good. And now I'm going to pull, and you pull. You ready? Okay, you got some strong feet. All right, and that's the end of my assessment. All right. So the first thing I do when I enter in the client's room would be to assess the contingencies of the client. So the first thing I'm going to do is I'm going to assess her pain level. So on a scale of 0 to 10, what would your pain level be? A 4. Okay. Do you have any allergies to anything, any food or medication? Okay. And a contingency while performing the procedure would be make sure you don't get any of the ointment or medication in the client's eyes or any kind of broken skin. Right, now, I will be moving on to the 3 checks of medication administration. So I have the physician's order and my MAR. Checking it. Okay. And then I'll check the MAR to the medication. Right. And now I'll check my medication to the patient.
You're like.
All right. All right. And I'll be administering a topical medication today, and it is a therapeutic, non-opioidal analgesic. And what that means is just a temporary pain reliever. Is that okay? All right. And I have my tongue blade here, my medication. So what I'm going to do is I'm going to hold my tongue blade and I'm going to pour the medication onto the tongue blade, making sure that the tip of the bottle does not touch the tongue blade. So I would apply it. Okay. Perfect. All right. And what I would do is I would apply it to the affected area. All right. And this procedure needs to take place 4 times a day, as the physician's order states. After I get done, I can dispose of the tongue blade, and then that's my medication administration procedure. So the first thing when changing a sterile dressing is you want to wash your hands, and then you would like to put on clean disposable gloves. So I'm going to get these things off. Okay. Let's see here. Here. How are you doing today? Good, good. I'm going to be changing your sterile dressing today. Is that going to be all right with you? All right. Now, I'm going to try to provide as much decency as I can to the client. So I'm going to pull the covers down a little bit. And since he has a gown on, I'll take the gown and just kind of, just so I can get in the working space. And what I'm going to do here is I'm going to remove the bandage, kind of holding the skin so it doesn't hurt that bad. Good. Okay.
See, now I'm second guessing myself.
Okay. All right, just kind of ease it off. With that. Ease it off. And what you're going to do is you're going to take this pad and you want to hold it away from the client so they can't see it. So you're going to remove it just like this.
It might be hard to, I'll send it.
Just like this. You're going to lift it up. Just like that. What you're looking for in the gauze would be the coca, would be color, odor, consistency of the drainage, amount of drainage, and approximation. Let's see here. And then what I could do here is this is done with, so I'm going to done with this. Now I'm done with this. That in there. Now what I'm going to do is I'm going to look at the wound and pay attention to the location, the odor of it, and the color of it. And everything looks good. So now I'm going to turn toward my sterile field, and at this time I'm going to open up my gauze. So I'm going to start from this way, going to this way, so I won't break my sterile field each time I go over a gauze padding. So at this time, I'll be careful not to pull really hard.
Now we're going to do an assessment of current lower extremities.
Okay.
Here I'm looking for color,
One.
edema, lesions, and symmetry. So, that's symmetrical.
All right, there's
No
two.
edema, no lesions, no color. Now, if anything was noted, I would document.
And this last one.
Now I'm gonna test
This
it
one's always
here.
kind of difficult to get out. So,
Warm and dry. That's good. Now I'm gonna check our pulses. The first one will be the dorsalis pedis, which will find it from the big toe.
all right.
It's steady and I'll grade it as
Now this time,
+2. And I'll take our other one.
I'm going to take my saline
Same.
and I would take off the lid, go around, make sure I go around my sterile field. I take off the lid and I lip it. And what that does, it just removes any kind of microbial bacteria that's resting right there.
Now check our other one.
And what I'm going to do now is
And that's the same.
I'm going to
Now
pour
I'm gonna check our capillary
on,
weight belt.
I'm going to pour it on just two of them.
I'll do that by
Just two of
pressing
them.
down on the top of the nail bed. Since she has to nail polish, I'm gonna do
Okay.
the sides.
I want to make sure I go around.
And it went back in less than 3
And
seconds.
now is when I put on
Check the other one.
the sterile gloves.
Now I'm gonna test her muscle strength. Now I have to flex your feet. And I'll press with my hand. Okay. And I'll pull you. Okay. Now tighten your toes. Flex them.
So,
And
I pinch these out of here.
that concludes the lower extremity.
What I'll do here
I didn't do that like.
is reach in here,
Well, y'all did that thing.
okay, making sure,
That's where I've always been mine.
and I'm going to start off with my dominant hand. So I'm going to go in here. Oh, they're sticking. All right. And then I'm going to get these two fingers
Almost done, y'all were almost
and
done.
go in here if I can. Oh goodness. I'm going to try to, I can't touch this part, but I can touch the under part and try to, being careful not to touch this part with this hand. Alright. 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 So, I finally got a hold of them. What I'm going to do now is put this glove on. Alright. Now, see, I got this one on now, so I can fix this. These are hard little boogers to get.
You know what you're gonna say?
Alright. Okay. And now, what I could do is I could use my elbow to kind of just hit that on the ground for right now. Alright. And now, what I'm going to do is I'm going to grab my gauze, and you can get it, and you can wring it out.
Alright.
And now, making sure not to turn your back to your sterile field. First, First, you're gonna go center. Then I'm gonna go distal.
I thought you were editing all our videos. Well, I said,
All right.
how you doing on that?
And
Because you were recording.
this one right here. These are wet as well. And there's an extra one. So I would do the proximal.
That way it'll be kind of in order.
And this one right here is just in case there's anything left around it that you think that you need to get off. And then I'll throw that one away. And at this point, see, there were 2 gauzes at the beginning. So I have 2 gauzes right here. And I'm gonna put the 2 gauzes right where they were when I took off the sterile dressing. So what I'm gonna do now is I'm gonna kind of try to taco it a little bit. So, and I'm being careful not to break my sterile field. Okay. So what I'm going to do here, I'm just going to lay it right there. Okay. And then I'm going to do the same thing with this other one. Making sure not to turn my back toward my sterile field. Okay. And at this point, I'm done with my gauze, but I need to put the ABD pad on. So I would grab the ABD pad. Be real careful. Flip it over, and the blue side goes up. So what I would do is I would just place it here. And now my sterile procedure is complete. So now I can remove the gloves. Alright, and now for the tape. So you're going to get the tape. And I always like to tape the front and the back and then the sides. So let's see here. So the front.
Now when I'm administering the eye drop, I'm going to ask her to bring her back.
And I'm being very careful not to apply any pressure on the wound itself while I'm putting on the tape.
Conjunctival sac, that's a shock. I couldn't think of his name. I was going to call it Musivac. Okay. Pull it down. You can start.
Okay. Now since we have the top and the bottom, I can do the sides.
Conjunctival sac.
Long piece of tape.
One eye. I'm going to ask her to close her eyes. And then I'm going to hold block away the excess. And then I'm going to hold this. Her nasolateral up for 30 seconds.
Okay.
And then the administration is complete. Sure. I bet.
Okay.
Pull down the and then do close eyes. You stated what the medicine was, you stated what the order was.
And now,
You stated that you're trying to get
last thing I'm going to do is I'm going to get my Sharpie. I'm going to get a piece of tape. I'm going to write the date, time, and my initials. Or T gray for me.
when she was
So.
dropping the thing in my eye, she said,
Hold on.
I'm going to drop the eye in the eye. That's what he said.
Well, I thought it was.
It's funny.
See here.
Okay, so.
So it
do you
is
wanna watch
9.
these and make sure that
30.
you like it?
It is
I don't like any of them.
12.
Don't. I don't. I messed up tonight.
5.
Don't watch it because you're going to find something that you don't like in the phone.
That's what I would rather just do it.
All right.
That's why I want to.
T gray. All right. Now we'll just attach this invisible site
What are you thinking?
right there.
Let's just go with it.
Then I'll make sure the client didn't need anything
You wanna
else
do me?
from me.
What? You wanna just
And I'll put this
yours
back in
on
my
me?
pocket.
You
Do you need anything else, sir?
Me, you can do
Okay.
that. Or-
Well, you just let me know if you need anything.
I should-
I'll clean up my mess here.
He's already got it on dressing on it.
Okay, that's fine.
There we go. And now I would clean up after myself. My sterile field became non-sterile when the package for my sterile gloves, when I laid them on the table, I opened them up and the right corner hit the gauze package. That was the moment that my field became non-sterile. After I'm done with my procedures, I will ensure the client's safety by making sure the side rails are up, both of them. Put this up. I'm going to make sure the call light is within reach. Here you go. I'm also going to make sure the bed is in the lowest position. Okay. Do you need anything else? Alright. And if you need me at any time, you can just hit the call light button and I'll come boogie in on to you. So the next thing I'm going to do is I'm going to wash my hands, and then I'm going to dispose of any kind of biohazard bag. If I used any biohazard bag, I would dispose of it. Then I would go back and I would document and report any kind of abnormalities.